what is this? I mean, what is this study that has just come out that has just blasted this thing out of the woodwork?
Let me just go over some numbers here that I collected.
The numbers are scary.
The numbers are scary, and
scary.
let's get to the you know, as much as we would talk about all age ranges, let's focus on the 12 to 19. That's for the teenagers.
That's where the study.
Yes,
yeah,
exactly.
Okay.
With the lowest vitamin D, you have 2.4 times more likely to have high blood pressure, 2.5 times more likely to have high blood sugars.
If their vitamin D levels are low. Wow.
Exactly. And 4 times more of what they call a metabolic syndrome. Got a little tongue tied there.
As I remember, metabolic syndrome is something that you absolutely do not want to have.
And it's a combination of various things.
Yeah, my recollection is where the truncal obesity, which we now know is a real problem, right? High blood pressure,
correct,
right? Bad cholesterol, elevated levels of bad cholesterol, and decreased levels of good cholesterol, and also elevated blood sugars.
Exactly.
I mean, and all of this from a deficiency of vitamin D or an insufficiency of vitamin D.
That's what they're showing. That's what they're telling us.
That's scary, because when you think about it, if you across the world now, what you've had are cultures moving, Dr. Mack, from the countryside to the cities, right? From sunlight to living in cities and suburbs, where they go from car to house to office to car to house.
You're barely getting any sunlight, and people are working through their lunches now. So by the time you're up early in the morning, you get into your car, you're not getting the full capacity of the sun that has to bring the vitamin D for you. And I'll tell you, if there's anything free in this world, it's vitamin D.
That is scary.